First, good afternoon, everyone. I'm Tash Churin, and I'm the Program Officer of EAB. First and foremost, I would like to welcome everyone to the training session on how to make the evaluation more responsive and face the challenges during such pandemic, which is supported by the UNICEF. I, along with my co-host, Dechin Dorker, will be hosting this program this afternoon. I would like to take this opportunity to thank UNICEF for this virtual training and their unwavering support towards EAB. This is the first time that EAB is organizing a virtual training, and it is a great pleasure to coordinate and host this virtual training. And I hope this training will benefit our members. I would also like to thank our three speakers for today's program for taking your time out to give us this training. Before we proceed further, I would like to share a few housekeeping rules. If you have any question during the presentation, please post it into the chat box, and later Dechin and I will monitor the questions at the end of each session. To go further with this program, I would like to invite our chairperson, Dr. Phunsu Chorin, to give us a welcome note. Over to you, ma'am.
Okay, thank you, Tashi. Good afternoon to everyone. I'm Phunsu Chorin, the chairperson of Evaluation Association of Bhutan. I would like to welcome everyone to the first ever virtual event of EAB, engaging our members. Today we are privileged to have with us the Deputy RR of UNICEF Bhutan, Mary Consoli, and team of experts from Rosa UNICEF, Ms. Rose Thompson, Mr. Tom Pallins, and Dr. Esther Kagua, who have spared the afternoon to be with us to share their expert knowledge and experiences. On behalf of EAB, it is a great pleasure for me to welcome all of you to this event. As we all know that we are living through an extraordinary time that is unprecedented. And this is the time when the role of the evaluation becomes most relevant than ever. And the time also offers a window of opportunity for us as evaluators to play more active role in contributing to reconstruction of economy and the society. And the time is also so right for EAB to reinforce its activities in demystifying the evaluation in the country. So this training is much looked forward by us, and the most relevant to the time as we needed to upskill our members. And I'm very happy to also report a brief account on EAB's progress during the year. As we all know that we have so many constraints, and despite all the constraints, and EAB has been able to make some important steps which helped us in building our own confidence and competencies in delivering our mandates. And EAB now has found our way to evaluation networks, both at region and at the international level. EAB is a member of Community of Evaluators South Asia for some time. And this year, we have joined APIA, WOPI at the Greater Asia Pacific region, and the IOC at the international level. And through this extended network, we have had many opportunities to participate in some important events. Recently, we have participated in Asian Evaluation Week, along with WOPI leaders from the region. And we have also taken part in the Eval Fest organized by EcoI in India in the beginning of this year. And we have also been very proactive and participated in many other events such as Evil for Action, where we are also a partner WUPI, and also we are now a member of Evil Youth Gensa network in the community, and also we have started collaborating with other WUPIs in writing up grant proposals. And that this is at the international and the network development level. And I would also like to emphasize here that to be an effective change agent, it is crucial for us to also look within ourselves, first to understand our own strengths and weaknesses. And Board of Trustees of EAB and the core working group members have been working hard on this. And at the moment, we are conducting situation analysis of EAB to gain better understanding of our context and to position ourselves, and also to inform our way forward. All these activities are opportunities for us to learn and to build our competencies. And as the chair of this association, I am very positive and have confidence in our Board of Trustees and the core group members in taking forward the association to the next level. And the capacity development activities, particularly today's training on changing landscape of evaluation under pandemic, is just relevant to the time. And as we adapt to the new normal ways, updating our skills enable us to be relevant and be effective in moving forward. And I would encourage all our participants here to be open and absorb as much as you can, and reflect on your learnings and be able to apply in your works. Now, lastly, but not the least, I would like to offer our appreciations to UNICEF Bhutan for supporting EAB throughout. And all the positive developments that I have reported would not be possible without your continuous support. And EAB hopes to carry out our mandates fully to fulfill our mission of promoting a strong evaluation culture in the country. And we look forward to your continuous support in the future. And on behalf of EAB, I would also like to extend our appreciations to the team from ROSA for making out time to share your valuable knowledge with us this afternoon. Thank you very much.
Thank you, Dr. Phuntsuk, for your warm welcome. Now, I would like to invite Ms. Mary Consolis, Deputy Representative of UNICEF Bhutan Country Office, to share the few welcoming thoughts of evaluation capacity development and introduction to the objectives of this training. Over to you.
Thank you very much. And again, a very, very warm good afternoon, even if it's a bit chilly now in Thimphu. Thanks to Madam Chairman for such a good introduction to and welcoming words to the trainees. It is an honor and a pleasure for us, UNICEF, to be joining efforts in this very timely moment where you're also looking into how to strengthen your capacities and assessing your needs to be able to undertake this training together. This initiative by the Evaluation Association of Bhutan is a great initiative in strengthening the evaluation culture and system in Bhutan. These issues will be also discussed in the course of the training. We strongly believe that by building partnerships in evaluation, we are actually reinforcing good governance, and we will earn better results for the children of Bhutan. So it's a very important session that we are conducting together. And as Madam Chairman has mentioned, I really also encourage you to attentively listen, but also ask questions as you move along in this training that my colleagues from the regional office have kindly accepted to facilitate. But I think the bottom line also is to link it to the emergencies and situation of pandemic like the one we are facing now linked to COVID-19, where we have to pay particular attention to including the issues related to gender equity while we do our planning and while we implement our intervention. So hopefully this training will be able to help rethink a little bit how we work together to get timely results, tangible results, and realistic also data for our work for better results for children. So I was asked to say a couple of words about the objective of the training. We have 3 objectives for today. The first one is to actually build the capacity of EAB members on the role of evaluation in the different settings like COVID-related evaluation of our intervention and response. Familiarize the members with the different tools that are available and the methodology, including the use of technology in your work as you go along, and also how to make sure that we are documenting what we're doing well in this pandemic situation so that we can actually see what opportunity exists and what we can improve in the next intervention response. And again, I think one crucial element is to build a partnership by creating really a platform where the exchange can flow and we can share good practices, best practices within Bhutan, but also across the region and why not globally. So I think those are the key 3 main objectives of this training. We hope really lastly that we'll be able to consolidate this relationship and continue working together towards an agenda of capacity building so that we have what we call a stronger evaluation culture in Bhutan. And to finish off and not take so much time and allow the training to kickstart, I would like to thank the government of Bhutan, particularly the Research and Evaluation Division, EAB, through the chairperson. Thank my colleagues in Rosa for facilitating this session, but most importantly, the members of EAB, who are the ones who are going to actually be the most important, crucial elements of the training today, for taking their time on a Friday to make this training successful. And with this, I'd like to wish you a happy training, happy learning, and hopefully more to come as we move along, particularly to establish at last a curriculum of training on evaluation, something that we've been discussing at the regional level as well, to see how we systematize learning on evaluation as well for Bhutan. And I thank you for your attention.
Thank you, Mary, for your words and sharing us the objectives of the training. And I would like to take this opportunity to thank UNICEF again for their support. And UNICEF has been our supporter from very beginning till now, and we hope these supports continue. And now, before we start with the main sessions, I would like to give a short presentation on EAB's work progress for this year. Current status of the EAB is currently we have 6 Board of Trustees. There has been a change from founding Board of Trustees, and now we have new Board of Trustees elected for members. And we have 28 active registered members from different professions and different organizations. Earlier, we were just a member with the community of Evaluation South Asia, but this year we have extended our network by joining as a member with the PIA and IOC. This year, the activities that we were carried out were, at the beginning of the year, we conducted a training on development evaluation. We had participants from various CSOs along with some of our EAB members. For the training, we had trainers from UNICEF, and one of the today's speaker, Ms. Rose, was the resource person for that training. Apart from the training, EAB had opportunity to attend the Eval Fest 2020 for 3 days, organized by Evaluation Community of India at New Delhi. Dr. Punso and I got an opportunity to represent and showcase the EAB at the International Forum. And we participated in poster presentation where we share about EAB and the work we have done so far after the registration with the Civil Society Organization Authority. And it was one of the milestones for EAB. And currently, we are working on situation analysis of EAB during this pandemic. And this study is conducted to understand the context and our positions within. This study is carried out by the co-working team formed out of the members of associations and our board of trustees. And for everyone's kind of information, our survey is still open, and if any one of you have not done the survey, we request you to please take up the survey and help us to understand the situation, as because currently we are working on this survey, and we are also redesigning our website, and till now we could not update any information on our website, but once we developed our website, we will soon be able to impart important information related to evaluation to everyone. And we intend to make our website informative and user-friendly and keep it updated. We have been actively trying and applying for the grants. A few of our proposals have been successfully shortlisted. However, unfortunately, for the first one, we could not meet with the criteria and got rejected due to the number of year requirement. Nonetheless, we are yet to receive the results for the others, and we intend to keep on trying in the future. And I, being the member of EAB, got an opportunity to expand my network through EAB, and now I'm the member of JENSA and Evaluate. And Evaluate is an international network mainly formed to promote the youth and young people in the field of evaluation. I have come to my end of my presentation, and now I would like to invite my co-host to introduce our 3 speakers for today's program.
Good afternoon, everyone, and thank you, Tashi, for the update on the work progress of our EAB network. Firstly, I would like to introduce myself. I am Dishan Dolkar, and I'll be co-hosting this session for today. I'm one of the core group members of EAB, and I'm also a member of Evaluate Asia and member and a country representative for Gender and Equity Network South Asia. It's a great privilege for me to be co-hosting today's session and to be amongst all of you. I hope you find today's session enriching and informative. Now, before proceeding further with the session, it's a great pleasure for me to introduce our speaker for today's program. First, we have Ms. Rose Thompson. Ms. Rose works in the UNICEF Regional Office for South Asia as a multi-country evaluation specialist. Her work covers Bhutan, Nepal, Sri Lanka, and Maldives, and she has thematically focuses on the supporting evaluation capacity development in the region. Before joining UNICEF in 2016, she has worked extensively with other UN agencies in evaluation, capacity building, and program management in different managerial and technical advisory roles. And the second speaker we have is Mr. Tom Pellens. Mr. Tom is a multi-country evaluation specialist at UNICEF Regional Office of South Asia. He has extensive experience in design and implementation of different evaluation approaches, among other quantitative impact evaluation, as well as mixed method theory-based approaches. He has been the team leader of evaluation and M&E and M&E projects across different social sectors such as social protection, education, nutrition, and child protection. Before his role at UNICEF, he worked at Oxford Policy Management, the Clinton Health Access Initiative, and Innovative for Poverty Action, among others. And the last speaker we have for today is Dr. Esther Kakwa. Dr. Esther is the Regional Evaluation Advisor for ROSA. She is a monitoring and evaluation expert with over 20 years experience in research and monitoring and evaluation. She has a PhD in public health with a focus on research in population from Johns Hopkins University and master's degree from Washington University, St. Louis. Dr. Esther has served as principal investigator, lead evaluator on numerous evaluations in the wide number of countries, and has trained diverse teams on research, evaluation methodology, and ethics in data collection. Before coming to UNICEF, she served as director and advisor of monitoring and evaluation at numerous global development and academic institutions, including Johns Hopkins University, Columbia University, and Management Science for Health and Project Hope Foundation. To begin with our first session, we have Ms. Rose, who will be talking about evaluation function in the development work. Before we head on with our session, may I request all the participants to mute your audio and post up any concerns, queries, and comments on the chat box below. And me and Tashi will be taking them towards the end of the session. Over to you, Rose.
Many thanks, Deshan. I'll be very short today because with most of you, we've interacted quite extensively in January, February with the 3-day training that we had. So I'm going to briefly kind of bridge recap a few items from that training to today's technical content. So, but before we go there, I wanted to quickly just check how many of you did participate in the training in January, February in Paro. So this is also just to test the Zoom polling, because Tom is also going to be using this for some of the content that he has. So let's see if this works. Let's see, can you see the poll? Okay, I think everyone has voted, so we'll end the polling and we have 50-50. Excellent. So that's good. We have some new participants and probably some from the Bhutan country office who did not join at that time because it was at the time of that big event on the religious leaders. So that's great. Okay, so let's move on then. I'll go to the couple of slides I have today. I need to share my screen first, I guess. Apologies, this always takes a little while. So, like I said, I'll try to be very brief today. I'll put still the presenter view. There you go. Yes, so a little recap from the January 2020 training. As mentioned already by the previous speakers, this year has been quite a year like no other, but it has also brought a lot of changes to the evaluation function and the way we conduct evaluations at UNICEF, but obviously also probably at your end as well. But if we just recap and go back a little bit to what we were covering in the training we had in January, we covered all of these areas. We talked about the reasons and the differences and the overall rationale for accountability, learning, and why we conduct evaluations. So we're not going to cover those today. And we also covered the entire evaluation cycle. And this is, it's quite interesting because we did, in that January training, we went through the entire evaluation cycle, and we deep dived into data collection and the methodologies. We covered many different approaches and evaluation designs because the participants at the time developed these case studies around very challenging and complex evaluations, and they had to develop the whole design and the evaluation case around them. So this is all, of course, still very, very much valid, but this year, this 2020, has obviously changed a lot of the way we conduct evaluations, and because of the need for evaluation, and also because of it's changed how we can conduct evaluations. So all of those will be covered more detailed in Tom's presentation later on. Here also the same, we discussed all the UN norms and the principles and some of the ethics, and today we will have a more in-depth discussion on those, what's kind of come into this, what's been unearthed during this pandemic. But just to say that all of these are obviously still very much valid, and today we're going to talk a little bit about ethics. We also need to talk about utility, because during the time of pandemic, of course, we need to be able to deliver and develop evaluations that are high in their utility because of the restrictions and the limitations that the pandemic situation puts on us, and the access issues, and also the evaluations that we are generating. They need to be of high utility, so that they're really worth carrying out in the times when everyone is incredibly busy, and our frontline health workers are busy, and so forth. We also covered in our previous training many of the different approaches to evaluations in addition to the actual designs. So we're not going to talk that much of these. I'm just highlighting the traditional evaluation approaches here, because today in Tom's presentation he's going to focus a little bit on something that we didn't actually focus so much in the previous one. Training. So here we also are not going to deep dive into these different evaluation approaches, but this is very much reflective of the way that we've been doing evaluations in the past. And we will still continue doing evaluations with these approaches as well, but I'm just highlighting these here as a sort of recap from the previous training. And also there was a discussion again to a little bit recap on how we fit evaluations in the results-based management cycle. So I just put this as a reminder and a recap of what we mean when we talk about summative evaluations, which have very much been, at least at UNICEF, we've done a lot of summative evaluations, which the ex post evaluations, which looks at the end of the programming or project, what has happened, and it's very much focused on the accountability side. And then we've also done a lot of formative ex ante evaluations, which then fit here at the beginning and look more on how we can improve the learning. So this is just a reminder on how we fit the evaluations in the RBM cycle. And I think that's all for me, because I was given 5 minutes, and I think I've stuck to that 5 minutes. And I think this is just a little warm up in terms of moving on to our next speaker, who is Tom. And I think this gives a good segue to Tom's presentation. And thank you. You have my email there, I think most of you. So if you have any questions, I'm always there to help. Thanks.
Thank you, Rose, for your brief and interesting presentation. So anyone has any question? I can't see any question in the chat box. Any question?
No, there's just a ask for all the presentations. We can definitely send all the presentations, and also we have also collected some resource materials, so we'll send those again with the presentation, so that the EAB can then share them with the participants.
Okay, thank you, Rose. And to move on with our next session, we have Mr. Tom, who will be talking about evaluation landscape, how to make evaluation more responsive to the pandemic using new approaches and technology. Over to you, Mrs. Tom.
Good afternoon, everyone. Again, it's a privilege and a pleasure being with you on this Friday afternoon. Let me share my screen with you. Can you hear me okay? And can you see my screen?
Yes, we can see us.
Yes, Tom.
Okay, great. So I'll be talking about making evaluation more responsive in this time of COVID-19 pandemic, and I'll look at it at 3 levels. The first more at the level of the evaluation function within an institution. And I'm going to take the example of UNICEF, because of course I work at UNICEF and I know how UNICEF's evaluation function has responded to this pandemic. And then at the second level, I look at some, how do you adapt your evaluation approaches? How do you do evaluation? And I'll again draw on some experiences from UNICEF to share that with you. And then on a third, even lower level, I'll talk a little bit about the data collection and how data collection can adapt to the pandemic. And I'll draw again on experiences from UNICEF. Before I start, I'll also do a little poll. So if you can answer, Rose, if you can put the poll on. And the question is investing in evaluation more, less, or equally important during this time of crisis? And what do you think? So while you vote, I'll continue and I'll look at the answers. We'll look at the answers in a bit. Okay. So first at the institutional level, so how did UNICEF evaluation function respond to the pandemic? And one of the first things that UNICEF re-emphasized strongly was what we call Rule 1, do no harm. Now this is an ethical principle that is always in the forefront of our minds when doing evaluation. Evaluation at the core is a very ethical activity. You have the word value in evaluation. So when the virus started spreading and also governments started taking measures, UNICEF was very acutely aware that some evaluation activities could pose a risk of harm to participants. And we had a lot of internal reflections around that, particularly around in-person data collection and the potential harm that could bring, because if evaluation teams and data collection teams would be going for data collection and doing that face-to-face, okay, you could have a risk of spreading the virus. Plus, a lot of people at the beginning, particularly during lockdown, were in stressful situations. So you need to take that into account when doing data collection. So this was discussed a lot, and after these discussions, UNICEF decided that in-person data collection was deprioritized. And of course, UNICEF also immediately said we're complying with all government measures as part of evaluation. So there was a lot of switch then to remote data collection and also rescoping of evaluations. On the other hand, we also thought that it was key that the evaluation function remained open for business, and we thought it was key that evidence and learning was there to support programming and the response. And Rose, please, could you show the results of the poll now? Let's see what everyone thought about this. So the majority, 50%, it's even more important, or equally important, let's say it's less important. So at UNICEF, we definitely thought it was even more important to the evaluation in time of this pandemic, and for several reasons. Particularly in times of crisis when there's a lot of uncertainty, you don't always know exactly how you're going to respond, or things are changing. So you need to correct your actions continuously, and evidence can play an important role and that. Otherwise, without evidence, you're steering a bit blindly in terms of your response. Also, you need to know if your response is actually making a difference, and if you're doing the right things. That's that element of relevance that we often look at in evaluation. Another element here and a reason is that resources during this crisis may be under pressure. No? So we need to look at, are we actually making good use of the resources available, which is this element of efficiency that evaluation often looks at. And then finally, I think Dr. Punch also mentioned it, evaluation plays an important role in reconstructing the country and thinking about sustainability when doing a humanitarian response or an emergency response. No? While doing this more crisis response, immediate response, you have to think towards the future about how do you build back better? How do you, link this humanitarian response to development? And evidence and evaluation can play a role again to pointing out how to do that best. So at UNICEF, staying open for business for the evaluation function was really important, but it does require us to rethink and rescope our evaluation and focus on what was most needed. I'm trying to go to the other slide. Let me see. Okay, let's go back. Then a third element where we discussed a lot was, okay, if we want to rescope and refocus, how do we do that in this time of this challenging time? And that requires thinking out of the box, being innovative. And one of the things that we changed a lot was really focus on learning in our evaluation and develop and promote learning approaches to evaluation, which means that evaluation findings need to be used quickly, and even during the evaluation process, you make use of the findings. You don't necessarily wait until the end of the evaluation itself. So it becomes a much more iterative process. This learning approach also meant that often evaluations were done much more in collaboration between the evaluators and the implementing partners, which starts to affect this element of the independence of the evaluation team. And that's maybe a trade-off that you need to take. On the one hand, you want much more learning and participatory approaches, but that can come at the cost of this independence. So that's something in UNICEF that we were willing to take, as long as that learning was very much there. And we were also adapting a lot of and experimenting a lot with new methods and methodologies. And then finally, what UNICEF emphasized a lot was sharing of all of this experimentation and doing things differently. Across, for example, the region, a lot of our country officers have tried out new approaches, and we created a resource hub to share all of that experience. So I think in times of crisis and challenges, sharing and learning among ourselves as evaluators is also key. So that's at the institutional level. Let me now go more at the level of evaluation approaches. And I want to just highlight two approaches. I've called them here alternative evaluation approaches, but they actually have been around for quite some while now already in the evaluation community. Nonetheless, they do take a little bit of a different approach than the more traditional evaluation approaches. So on the one hand, you have developmental evaluation, which is a bit of an approach similar to when you do research and development. It is, as evaluators, you come in to really help co-design and design new ways of working, and help innovation in a rapidly changing environment. Real-time evaluation is an approach that comes from humanitarian action. and is meant to provide rapid feedback during emergencies. And let me just go through them with you one by one, and also give an example how they've been applied. So development evaluation is an approach where you embed evaluators within the program itself and to provide real-time ongoing feedback to the implementation team while the program itself is adapting to a rapidly changing context. So the evaluators almost sit together with the implementation team, and this happens at a very early stage in the design even of the response or the program. How does this happen? You really have to establish an ongoing relationship between the evaluators and the program team itself. So it's a continuous exercise rather than a one-off. And the role of the evaluator here is to really facilitate discussions based on evaluative questions. There's a lot of questions of why, and why. Why are you doing this? Why are you making these choices as implementing partners? So the evaluator comes in as this a bit critical third person, that asks evaluative questions. And they encourage program managers and implementing partners to continuously collect and analyze and use evidence while making programmatic decisions. So this focus in terms of scope of the evaluation is on these evaluation questions, to really stimulate evaluative thinking and adaptation. And it's less on thinking about, okay, assessing, did you achieve your program objectives and how well you achieve the targets of your indicators? Because often these project objectives are themselves changing in the early stages of this response. And it's not about providing recommendations at the end of an exercise, but really during the implementation, facilitating decision-making throughout. There is no fixed steps, or a template to do this, and you basically use data collection methods, that are most useful for the questions that you have. It's very learning focused, and really to improve performance of the program. It must say this requires some trust, between the evaluators and the implementing teams, so that the implementing teams share all of the difficulties that they're having, even their failures with the evaluators, so that you can quickly act on them and change direction. You need highly skilled evaluators for that, time to invest, and also practically a flexible evaluation budget and work plan, because you don't always know where the evaluation will end and start, or what methods that you will use. And in UNICEF, we've been applying this at our HQ level in New York. They're implementing at the moment a COVID-19 learning evaluation, and its objective is to provide timely, good enough evidence to inform decision makers in adapting UNICEF's approach to COVID-19. And here you have it that the evaluation office in New York has contracted an evaluation team to be embedded in the COVID Global Secretariat of UNICEF. And continuously there are questions being asked and discussed that are timely at different periods of the response. It's very flexible and iterative, and methods are being used differently depending on the questions. A lot of key informant interviews are used, a lot of document review is done, but actually the method change depending on the questions. And the focus here is on the role of UNICEF headquarters in this response. And they're following this cycle of sourcing some questions, prioritizing the questions at the moment given the issues at hand, and collecting and analyzing data, and then answer the questions and develop some learning products around it. And it's a very cyclical process. So that's one approach. You really have almost the evaluators, you have them embedded in your implementation team. The other approach I want to talk about is real-time evaluation, where the evaluation provides real-time feedback during the implementation of a program within a very short time period, again, to enable program improvement. In this approach, the scope is already a little bit more defined, less open, but it's pretty focused. No? So you define evaluation criteria and questions, but they're generally limited. And for example, you generally don't look at impact questions or like that, but it's more on the relevance, coherence, connectedness, and early results. So you do start looking at emerging results, and what also is often checked is compliance with certain standards and policies. For example, at UNICEF, we often then look if the core commitments to children, which is a core standards for our humanitarian response, are complied with. It's generally through a very participatory process where external evaluators are joined by some internal evaluators to do the evaluation. It can be a one-off exercise, but it can also be an ongoing exercise. Very learning focused, and what is also interesting here, you generally wait a little bit when the response already happened, and then you do the evaluation. Requires quick scoping, flexible evaluation team, and a very engaged implementation staff, because you do during this emergency ask time and engagement of implementation staff that are sometimes under pressure to implement a humanitarian response. So they need to see the utility of that evaluation. And in the current COVID pandemic, our India office is conducting a real-time evaluation where they're looking at the relevance, coverage, effectiveness, and efficiency of UNICEF's COVID crisis response. And the idea is really to provide immediate feedback and recommendation for improvement. They've hired an external firm, which is working very closely with the internal evaluation team at the India office. It's very participatory and consultative, where program teams are engaged, to share experiences. But there is an independence of the evaluation team that is kept. And that is because this accountability element of evaluation is starting to play more even than what I discussed in this developmental evaluation. So that's why the independence of the evaluation team is important. It's again using a very flexible data collection strategy, but it is already a bit more outlined. And it's focused. A lot of document review with a set number of key informant interviews and focus group discussions, and focus on a specific sample of states. And what happens is the UNICEF response is according to 6 pillars. And in this case, each pillar is being assessed every month. And that's in an ongoing process then. And per pillar, per month, there's a short brief that is produced, and that feeds into UNICEF's crisis management team meetings. So that's that utilization focus that is really emphasized. So these are 2 approaches that I wanted to share with you, and maybe some key takeaways that you see here is that one, they both really have a very strong learning and utilization focused approach, because you need to have quick learning during crisis and emergency, and people need to see the value of it, that they want to participate in this. The timing of this is of course key, and also the timeliness. It needs to be quick to enable adaptation and improvement. It's often iterative, participatory, and the scope of the evaluation is often a bit flexible and need to be focused. It can't be a very big scope. The methods itself are not necessarily fixed, so you need to adapt to the questions and the context that is prevailing. And I think a last element that is important is you need to try, or what is important is to get feedback from the affected populations themselves. What do they think? What is the voice? You need to give voice to the people that should be benefiting of all of this implementation. So this is about general approaches. I still want to talk a little bit around the use of remote data collection methods and tools itself. And here I want to touch on four remote data collection approaches. So most of you generally know that we collect data through face-to-face data collection in a survey or through focus group discussions. But during this time of the pandemic, where there's a risk through the interaction of transferring the virus, there is a need, of course, to switch to more remote data collection approaches. And there are four approaches that I want to highlight. One is doing phone surveys, which is basically, okay, it's the closest to face-to-face data collection, but it's just done over phone. And it still means that you have a one-on-one interview between an enumerator and a respondent. Another approach is interactive voice response, abbreviation IVR. Here, the survey questions itself are pre-recorded, and then the respondents are called and invited to answer the set of recorded questions. It's like what they refer to as a robocall. And you can even use different voices for this. So you see there's no personal interaction with an enumerator. Generally, you need to really stick to a very small number of questions that a person wants to respond to. And what the respondent does, they answer through pushing the buttons on their phone. Another approach is an SMS survey. The term says what it is. You send your survey through an SMS. It's self-administered then. And you get the SMS on your phone, and the advantage is you can really send this survey out in bulk, and you answer that on your phone, question by question, by pushing the buttons again. And then finally, an online survey. Then again, this allows for more written answers. It's again self-administered. No enumerator comes into play, and you fill them online. A well-known tool is SurveyMonkey that you may have used. And here you could first even send the link through SMS, which then links you up to an online platform where you fill out the survey. So let me just check the second poll here to see who has used these. Rose, could you bring that up?
Sorry, I'm muted. So we take the third one. Shall I launch it?
Yes, please.
Okay.
So yeah, the question, have you used the following remote methods to data collection before? And let's see what the answers are. So Rose, just launch it when you have it.
Yeah, you mean the results? Yeah, they're still
The
coming
results.
in.
Yeah.
Yeah, almost there.
Okay. Yeah, let's show them.
Okay.
Okay. So there's quite a lot of people that have used online surveys, and some, quite a bit also worked with phone surveys, a little bit less with IVR and SMS surveys. Great. One other tool that I just want to mention, let me see if I can go down. I'm trying to switch. Okay. So one tool some of you have heard of is Rapid Pro, and this is an open source communication platform, and it's used to send and receive data, no, using mobile phones, and it can be used to design surveys, but also to analyze them in real time on a dashboard. And UNICEF has used that a lot, and you see here a map of the world. Which is already, well, it's from February 2019, where you see where UNICEF has used this platform to connect with community members. And maybe some of you have heard of Europort, which is one application of Rapid Pro, where UNICEF sends messages to young people called Europorters and receives feedback again. And this is an open source platform. And the big advantage is that actually you can communicate in different channels to people, depending on the context and how people are with the channels that people are most comfortable with. So you could send messages through SMS, but you can also communicate to Facebook, and you could even design IVR if, for example, you want to reach certain people with less literacy level or access to smartphones. You can even do that. So I just wanted to mention that, and one of the resources to the webpage is at the end of the presentation, with a lot of explanation how you can design surveys through that platform. Okay, so I want to finish with just reviewing a bit the pros and cons of these different data collection methods, and I want to open it up a little bit for you also, to say, for example, I want to go through the four, what the pros and cons you think are of these different remote data collections. So for example, phone surveys, please put in the chat what you think are pros and cons, or just speak up. I'll show what I think, but feel free to come in. What do you think would be an advantage or a disadvantage of doing using a phone survey? Anyone wants to share something?
I think on the chat, Tom, are you able to follow the chat?
I don't see it. Yeah.
Do you want me to read? So
yeah, great.
The pros are faster. There's several faster. Cons, respondents digress a lot, was a good one.
Yeah, exactly.
So, and let me see, what else is there? Yeah, that's so far, but the cons, cons, lack of rapport and interactions and reading expressions.
Okay, that's an interesting one. No, so here, I think they're all true. If you compare with a face-to-face data collection, indeed, you have less rapport that you build. But nonetheless, I think compared to the other remote data collection methods, it's probably the one that you still have the most possibility to build rapport. No, it's not like face-to-face, but with the others, at least as an enumerator, no, you can still talk to the respondent. And that means that often with a phone survey compared to the other ones, you have also higher response rates. No? Of course, compared to face-to-face, you will have lower, no? Because when you go somewhere face-to-face, of course, you always need, survey is always voluntary, but it's, yeah, it will have higher response rates when you do it face-to-face. It allows for both quantitative and qualitative questions, even open-ended if you do it over the phone, and it can work in low literacy context because you're speaking to someone. As a con, like, you need to have access, of course, to phone numbers. No, and it excludes who doesn't have a phone, and you will see that for a lot of these remote data collection tools. This is one of the key disadvantages. It will be more expensive than the other remote methods, because you need to have these enumeration teams that you need to train and need to put into implementation, and you need to have well-trained enumerators. The next one is this interactive voice response. Anyone wants to contribute something in terms of advantages and disadvantages that you think there are? Rose, if you see something on the chat, please, but feel free to speak up if you want.
There's language barrier
Mm-hmm.
on the cons.
Well, with the language barrier, you can have the translation, no? So we're doing that, for example, in Pakistan and in India, where we have these self-recorded messages that are translated in different languages, which is possible, unless you mean something else with language barrier.
Accurate information.
That could be, but not necessarily. There has been research done that if you keep these interactive voice response questionnaires small and simple questions, that doesn't need to necessarily lead to inaccurate data. Unless you are saying that there could be biases of who responds, because it is generally so that you have a lower response rate. No, people drop off more quickly, and if that is if certain types drop off more quickly, like for example women, you may have skewed and biased response, which then of course have an effect on the accuracy. I think the advantage is it's relatively quick to set up and less costly than a phone survey. You know, you can have very standardized questions, and there is no interviewer that comes into play. So there's no bias from an interviewer that may be interpreting the question or sometimes asking the question in a different way, which sometimes happens. No, a phone survey is dependent always on the quality of your interviewer. Of course, the IVR questions is then dependent on the quality of your questions. No, another advantage is that this can work in low literacy context. No, people don't hear something, but they don't have to write something. They just have to push the button. It does require certain literacy, phone literacy. And yeah, one of the limitations is that you can really ask only a limited number of questions, and you can only ask questions that have a single answer option. You can't have multiple choice questions because people push one button on their phone. SMS surveys, another way. Any suggestions of pros and cons?
You can also just open your mic and say it loud if it's not, it's quicker. There's one con, and it's expensive.
Well, maybe the setting up, if you don't have the technology, you do need to have access to the technology, but there are organizations that can quickly set that up and have all the platforms, like for example through Rapid Pro, which is an open source platform. It doesn't have to be too expensive, because you can, like I said before, you can really send these messages to a lot of people. But what is, of course, maybe what you mean is there is an SMS has a cost with a telecom operator. No, that's true. And it's always important with SMS surveys that you think about who will bear that cost of the SMS. You need to generally take that on, as a survey implementer, that the respondent doesn't need to pay for the SMS cost. So a couple of things I came up with is, again, it's pros. It's relatively quick to set up, if you have the platform in place, and actually generally quite inexpensive. Like I said, you need to think about who pays the cost of the SMS. The respondent can complete this at his convenience or her convenience. So phone surveys and IVR, it's someone calling you, and if you don't have time, no, you will say no to the survey. And SMS, you can answer when you want. And SMS technology itself, no, is pretty basic. No, it can work on a lot of mobile phones. People are familiar with it. It does require some literacy of the respondent. No, you need to be able to read it. No, and of course, like all the others, you need access to phone numbers, and it includes who doesn't have a phone. Again, even more so than IVR, it's very short questionnaires with very short questions. And SMS can have only a limited number of characters. And then finally, online surveys. Anyone who wants to come in? Rose, anything?
Lots of tools.
Like there are a lot yeah, I assume that that's an advantage. There are indeed a lot of tools that allow you, even open source, to allow you to develop online surveys. Like even a simple Survey Monkey, I think if that's referred to, I think it doesn't have a cost and you can roll it out pretty easily.
There's another one, requires literacy.
Yes, exactly. So it does require literacy. It's again, you need to read and write. No, okay. Some of them are in terms of writing, it doesn't have to. Sometimes it's just closed-end questions where you have answer options. But I think the advantage of an online survey is that you could also ask open-ended questions. So which with SMS and IVR are not possible. It can be, again, quite quick to set up and inexpensive, like with these basic online tools. You can link it also to real-time dashboards and analysis forms. These are all available online. Again, the respondent can complete it at his or her convenience. Can be longer. No, you can scroll to an online survey. And as a disadvantage, I think, it's even here, you even need access to internet. No, while with IVR and SMS, you just need access to a phone, no, or a smartphone. Here you need access to internet. In terms of sampling, generally it's done very purposefully and at convenience. Generally, these online surveys are almost blasted through networks, no, and you don't know who in the end you will get. There's often not a sampling frame being used. And generally also low response rates with this. So let me wrap up just as a final slide, probably already over time, some critical considerations here for this rolling out using remote data collection tools. One, you really need to weigh risks and benefits here. I think the reason why this has been rolled out a lot now is because it avoids in-person contacts, no? And it can keep the surveys very short, you know, which in this time of stress and pandemic is very useful. But you do need to take into account that potentially you have limited coverage of the most vulnerable voices. So from an equity perspective, and I think Marie-Consolé also stressed that how important that is, maybe you're not reaching the voices or reaching the most vulnerable with this remote data collection tool. And also in terms of depth of data collection, it generally more limited than face-to-face data collection. You may not fully understand the issues with a very short survey, which you may want and need. You do need to think very carefully about the sampling, no? And that starts with the sampling frame. So from which frame, which list are you going to draw the sampling? There are different possibilities. No, you can use contact lists of existing surveys. You can use, sometimes I've seen it, government databases, mobile phone operated databases, construct your own sample frame, or what they call random digit dial with phone surveys where phone numbers are generated at random. What is key really is always asking a couple of key social demographic information questions from the respondents. So you at least know, even if the sampling was not completely random or the sample frame was not covering the whole population, that at least you know who's in your sample. No? That you know, for example, are there is your sample skewed, for example, in terms of gender? Maybe it's not 50-50, or rather that you have less women, but at least you know it. And in this, you can consider what they call quota sampling, to say, okay, I really want a certain quota for a certain respondent. And for example, we've done that with interactive voice response, where often women respond less to this to these surveys, also because their phone use is sometimes less. That we say to the survey company, we want you to keep on calling until you have 50-50 representation, men, women. And what is key here, some of these remote data collection approaches will have limitations in terms of representativeness, but you need to then acknowledge that and be transparent about it. Another point to really take away is keep quality really in mind, and that is really about reviewing and pre-testing your questionnaire, and do that again and again. Keep it short and relevant. If you include long questionnaires, this will always come at the expense of quality and the response rates. And adjust the size of your questionnaire to the modality. This SMS survey will have to be very short. A face-to-face or phone survey can be a bit longer. And finally, ethics is really important in remote data collection. You're calling someone in his private space, so you need to ask for consent, like you do with a face-to-face data collection. Keep confidentiality and protection of the data in mind, and avoid direct sensitive questions, particularly in times of stress of the pandemic. For example, we're generally we're discouraging asking, for example, questions like violence, or domestic violence in a direct way over the phone, because it is often very sensitive and you don't know about the privacy of the respondent. So I'll stop there. Thank you so much for your attention. I've added a couple of resources at the end of the slides that will be shared with you. And over to you, Rose or Dechen. Thank you.
Thank you, Tom, for a very enlightening and very interactive session. We have a couple of questions here. Since we don't have much time, we will be taking 3 to 4 questions. So the first question we have is from Mr. Som Galton. He asks, what if the final findings of the evaluation differ from the stage finding, which could have been implemented in the interest of the situation and time? Huh?
So can you repeat that? So when the final findings?
Can I just convert it into a short question?
Sure.
I think he sort of meant that during the design, we intend to evaluate something, and however, as we go ahead, we do have situations like COVID-19, and then how does it impact our evaluation process and findings?
So in terms of the
is it correct? Sonam is online.
Yes, madam, right.
So I think in terms of the design, you will have to adopt. First of all it will affect the way you collect data. No, and that's why these remote data collection approaches come into play. But not all evaluation questions potentially can be addressed through remote data collection tools, and then you have to consider if you rescope your evaluation and see, or you delay certain questions to another time. But a lot is possible through remote data collection means. For example, we've started doing a lot of the key informant interviews through remote, through telephone interviews or over Zoom, and so you can actually answer a lot of the questions through these modes. You do need to think a little bit if your evaluation questions are also still the most pertinent given the context. No? You want to ask maybe the most relevant questions at that time. that's that utilization focus. What do you really want to know, given that the context has changed? Are you still asking the most relevant questions? And that's also something to think about. I hope that addresses addresses the question that you had.
Hello, Ms. Ms. Sonam. Hope your questions are answered. Next up, we have a question from Ma'am Finsuchoden. Ma'am, could you read your question?
Okay, my question is on like when you talked about the developmental evaluation and the stages and all the cycle it goes through seemed to me like it is very similar with how we also conduct the culturally responsive evaluation. So I was wondering like whether culturally responsive evaluation does that fall under the umbrella of developmental evaluation or not? So that was just my clarification.
It could be. I'm generally not too hooked up on the labels that we put on our evaluations. I think you need to look at the key characteristics. What is very specific to developmental evaluation is that the evaluation team really is embedded almost in the conversations and in the design of the interventions. No, so you really have this embedded evaluation team. What you don't see that much. No, even you do see more an iterative process of asking questions and then answering them, and then again answering questions. But having done that through an evaluation team that is very close to the implementing agency, and where you give up a level, you give up the independency. No, is pretty unique to that approach. I don't know if in your situation that is also happening. And particularly, what another key characteristic is that the evaluation teams really come in very early on in the program cycle, or the response cycle, almost at the design stage. While generally evaluators come in at the end, or maybe in a formative stage during implementation, but not really at the early onset of the response. But maybe you can explain a little bit how you do it, and if that is aligned with what I'm saying now.
I'm not talking about the approaches we followed here in Bhutan or something like that, because evaluation it's new to our, it's quite new to our context, yeah. So we do not stick to one or another kind of approaches of evaluation. But right, currently I'm reading I'm working in the space of culturally responsive evaluation, and I have been reading all the literature in that space. So I have, while you talked on the developmental evaluation, it sounded very similar to very closely linked to the culturally responsive evaluation kind of procedure they follow in that kind of evaluation. So that's why I was thinking whether these two are of similar kind of approaches, or that's what I thought, when you explain the developmental evaluation. Yeah.
I think developmental evaluation can be culturally responsive, and it's likely you have to be, because you really have to, you need to respond to context, and cultural part is a key component of the context, but it doesn't have to be. I would advise probably a developmental evaluation to be culturally responsive, because you need to really you need to be very situationally aware, as an evaluator. You need to understand what is going on, basically. So you can
Yeah.
quickly respond. And part of that understanding what is going on is the cultural context, no? No, who's involved. So I think you're probably right, yeah.
Thank you. Thank you so much for that.
Just to add on, Tom, I think the same applies for gender and equity as well. We do the same, we follow the same process of evaluation. However, we are very sensitive. We have to be sensitive towards gender and towards equity. And that's how I understand the cultural sensitivity also.
Okay, yeah. But you can, of course, be very gender sensitive and equity sensitive in a very traditional evaluation, no, where the evaluation team comes in at the end and looks at all the typical evaluation criteria and has this very independent role. And we generally advise, particularly from UNICEF, to be very gender and equity sensitive.
Okay, thank you, Tom, and thank you, ma'am, Dr. Finso and Ma'am Dishan. We'll take in the one last question from Mr. Tashtandu. The rest of the question, we're very sorry because we have limited time. We'll be taking in the questions and sending it to Mr. Tom, if it's okay with him, and we'll be sending you the answers for that. So, Mr. Tashi, can you read your question, La? It seems Mr. Tashi is not online, so I'll read his question. He says, evaluation in its nature is a collaborative exercise with various stakeholders. How do we ensure undeterred evaluation in times of pandemic?
How do we ensure, sorry? Could you repeat the last part?
How do we ensure undeterred evaluation in times of pandemic? Undeterred.
Undeterred.
Yeah.
In terms of that collaboration continues? Is that the question?
I think he meant that.
Okay. I think it is more challenging. It's not impossible because I think through all the remote means of communication, you can continue the collaboration. But for example, evaluation does require a level of trust and engagement, which I think my personal experience, face-to-face interaction does help with that. So that's then it's a bit more challenging, I think. But there are participatory processes and strategies of engagement that you can do with different partners, to keep it very collaborative. What we're doing now, in the end, we're experimenting with this more remote data collection, and we're still trying to do it interactively. It's not as possible, but it's not impossible. Yeah.
Tom, I just want to give an example. I don't know if it is answer to this question. For example, when we have we are currently doing the evaluation of UNPRPT, that is for persons with disabilities. And just to make sure that persons with disabilities are also included in the evaluation process, we have actually, we have pulled together all these relevant stakeholders, important ones, in the reference group, including persons with disabilities. Will that somehow, ensure collaboration when we conduct evaluation?
Well, I think it's one of the platforms to facilitate engagement, the reference group, for sure. I think it's very important. Of course, a reference group that meets a couple of times is not the same as doing everything in a participatory manner. No, so for example, if you as evaluators design the evaluation together with people, with a lot of other people continuously, the levels of participation and engagement will vary depending on the needs and what is possible also. Yeah.
Sorry to interrupt. Thank you, Tom, and everyone for this interactive session. Since we have limited time, we should proceed with our next session. Thank you, Tom, once again. And up next for the last session we have is by Dr. Esther, and she'll be talking on the ethics, risks, and challenges in evaluation work during the pandemic. Thank you. Over to you, Dr. Esther.
Can you hear me?
Yes. Yes, it's very clear.
And can you see my screen?
Yes, yes.
I hope it's in slideshow. Okay. So thanks a lot, Tom, Rose, the association, and Bhutan UNICEF office. Thanks for the opportunity to learn from each other. So my challenge today, or my mandate, was to talk about ethics, risks, and challenges. We will go through it briefly. So, I mean, there's a lot more that we can talk about both of those issues. So I will be talking about the general risks that we face in a pandemic. You know, I think part of what Tom has discussed, you know, discussed and talked about the landscape, you know, so, but what are the general risks and the challenges given where we are going and what we are going through in a pandemic, and also the, particularly more so the ethical risks and challenges, yeah? So when we are talking about the general risks, I think Rose had presented both this time and before a cycle, the evaluation cycle. You know, it might be different steps that every organization has, but generally we have a planning phase, we have an implementation phase, and then we have, you know, what would be the data analysis and dissemination phase, as you know, the general three phases. In between, UNICEF, you know, has inception reports and all those other things. So when we are looking at risks and challenges, you know, definitely the pandemic, COVID, but also any other humanitarian situation poses some risks. At the planning phase, we always like to involve people. The UNIC guidelines talk about accountability and involvement and respect, as we'll hear. But as we proceed to do evaluations during this pandemic, we have to look at what are the risks in the planning phase. And the risks are many. You know, they include failure to vet questions, failure to involve stakeholders. Are we asking the right questions? You know, we are in a time of real data collection. Stakeholders need data quickly, and the pandemic is changing also. And so we have to keep up as evaluators and evidence people. But are we really going through the planning? Even in a pandemic, there should be a reasonable level of planning. There should be a reasonable level of involving stakeholders and the usual things that we do. And so there are many other risks at planning, for sure. You know, allocation of resources. Are we putting the right allocation? Are we putting the right allocation for data collectors to protect them from the pandemic? You know, so a lot of risks that we have to think about. And, you know, as we discuss risks through the cycle, you know, what comes up, and we are discussing them purposely to see how can we mitigate these risks. Yes, the pandemic is here, but the first step to mitigating a risk is actually acknowledging it. So acknowledging and brainstorming around these risks for any evaluation that you're going to start. At implementation, of course, there are many things. There's quality is always a big thing, yeah. You know, quality and fidelity to the methodology, yeah. You know, the pandemic is making it relatively hard, even in situations where we have changed to remote data collections. We have to make sure that there's fidelity. If we've said we are going to do remote data collection by a particular number of people, you know, so for implementation, the risk could be in times such as this. a risk to actually of not implementing the whole evaluation design, whatever that design has been agreed upon. There's also risks around recruitment. You know, people are in their houses, there are lockdowns, there might be a limited number of data collectors. Quality begins with the people that you hire. So that's another risk. Then, of course, data quality mechanisms, you know, we always emphasize during implementation, have your quality control checks, you know, beyond methodology. Are we getting clean data? Are people actually asking the right questions? You know, so even in a time of COVID and lockdowns and limited movement, you know, there should be the emphasis on what are the quality control mechanisms? Are we getting third-party monitoring? You know, what is it that we need to ensure the best quality we can get for the times, yeah? And then, of course, you know, failure to reach respondents. You know, the risk is major. You know, I know that for many evaluations, people are giving up on sampling, but even if we do purposive sampling, sample sizes are low. So there's that risk. How do we mitigate the risk? So we have to think about it upfront in terms of mitigating all the risks. And these are just a few of them that we might face in a pandemic during implementation. Then, of course, there are risks during data analysis and dissemination. When we are talking about participation of stakeholders, you know, we like to say that stakeholders were involved in both data analysis and the interpretation of the data and its dissemination, yeah? Unfortunately, sometimes, and in times of pandemic, we are not able to reach some stakeholders. But the question is not that we are not able to reach stakeholders, but have we done enough? Are we using the pandemic to eliminate the stakeholder face, yeah? So, and then there's also with the urge to produce data quickly, there is a risk to rush, you know, and use data that's not adequately cleaned. The methodologies we are missing, we are using remote data collection and others come with their own limitations, yeah? And so the risk of giving stakeholders uncleaned or poorly analyzed data is still there, especially as the demand for data is increasing and changing constantly. And then also dissemination, you know, how are we disseminating? You know, we, for many of us, you know, the traditional style of dissemination, we sit in a room, somebody presents, is what we have been used to. COVID has taken that away. You know, we are now doing dissemination by Zoom. Who are we leaving out? You know, so there's that risk of failure to disseminate to the right people. And then, of course, there's the risk to use results, you know. So the question then is, for these risks, is have we looked at the risks across the cycle, and there are more of them, and how are we mitigating them? Particularly when it comes to using results, data is turning around really fast, you know. Before you know it, there's another survey, there's another survey. Are we really using all these results? And then what are the implications? You know, I mean, there are so many competing priorities. What are the implications of the data that we are using? Are we at a risk of collecting more data than we need? So I'll stop there for the general risks. Now, the other main thing that I think the association wanted to talk about were the ethical risks and challenges, and those are many, and many indeed. I mean, COVID has changed the way that we collect data, the way that, you know, we have instituted consent, the ethical RBs, some of them are not meeting, the groups that usually ensure those protections of human subject research, research subjects may not be as functional. So I'm just projecting here you know, some of the UNICEF ethical standards, you know, and, you know, these are very consistent with the United Nations Evaluation Group standards, which I'll show in the next slide. But, you know, we like to say that, you know, respect, when we talk about respect, we're talking about the autonomy of the respondent, of the persons. We value them as people, we value their beliefs, their capacities, their ability to make decisions for their own. And then also justice, you know, and when we talk about justice from a UNICEF perspective, we are saying who is benefiting, how are the benefits actually related to the people sharing the burden. And then, of course, we always say do no harm. So beneficence and non-maleficence. In every sector and in every organization, you're going to find this as an underpinning a foundation for ethical implementation of evaluations, yeah? What is that harm benefit ratio And the goal is we should do more, the evaluations we are conducting should have more benefit than harm, more benefit in terms of outcomes, more benefit to the respondent, more benefit to the interviewer. So as you will see, those UNICEF principles are aligned with the United Nations Evaluation Group principles. We have beneficence, we have respect, and then also we have accountability and integrity. Yeah. So, for respect, the justice concept from UNICEF actually is under respect for UNEC. But integrity includes honesty and truthfulness, professionalism. How do you present the results? Are you impartial? Are you independent? And so what are the implications of this? And then, of course, accountability. When we are looking at accountability, we are still accountable, accountability for the methods, accountability for people's time. We are not wasting people's time, and then taking responsibility. So then I'll begin to discuss just a few things that we would think about as we are looking about the different ones. So beneficence and maleficence. So harm, benefit and harm, So are we actually doing more good? COVID is everywhere. So what is that balance? And this has come into a discussion when you're talking about face-to-face data collection versus remote data collection. What are the risks of the data collector or the respondent getting COVID? How about other risks, anxiety, worry, stigma of any of those? Yeah. And then how about the resources? Are we benefiting the community more by doing our studies, or are we insisting on studies that might take away resources from other things? So the study as a whole should benefit more than do more harm. So it should benefit from a resource perspective, from a burden perspective. Are we burdening people more than the results are gonna come in? And so when we are saying benefit versus harm, it is across the spectrum, yeah? So what's that benefit harm ratio to the individual, to the community, and to the country as a whole? And we are still, even in the times of COVID, the benefit has to outweigh the risk. Vaccines are coming, and at some point, I think we will evaluate the different modalities of adopting the vaccine and rolling out the vaccine. Are those modalities benefiting the system more? And is the research we are doing and the evaluation we are doing around that actually having more benefit? Okay, so then we talk about respect, and the dangers in COVID around respect are many. We are not able to access stakeholders. So usually we say you respect the person, and the way you respect the respondent is you involve them in all stages, planning, interpretation, yeah? But for COVID, with the lockdowns, are we using that as an excuse, And, the barriers are real, but can we try harder to respect participants by involving them? How about decision making? Who is making decisions on what and how findings can be used? Yeah, I'm sure, in some epidemics, I think we haven't gotten there for COVID. Sometimes there's the perception that the risk of death is so high from a particular disease that it outweighs the community's right to make decisions on how findings are applied. What is that balance? Do we still, even in all the findings and in all that we do, still respect the community, the individual, and the society's a right to the use of evaluation and the involvement across the board? How about consent? In many evaluations, we are used to written consent. When people can't write, we do a thumbprint. Now we actually are not able to access those respondents, but we still have the mandate of respect and voluntariness. Now the question comes in, how are we ensuring that? If somebody says, I got oral consent on the phone, do we have a mechanism to actually make sure that, the person on the other end of the line actually consented, yeah? And then there are issues around language and connection barriers, yeah? When we talk about consent is no consent if it's not informed. So we usually like to say it's informed consent. But, so informed consent by nature carries a mandate of full disclosure. Now, COVID has presented issues around language. We are not able to do face-to-face. We are, calling people on the phone. Is that limiting the ability to which this person is really giving their full consent? Yeah. And, what happens when we get to a point where there's either internal pressure or external pressure for certain populations to participate in evaluations, You know, what are we going to do as a community? And then, of course, confidentiality, you know, respect carries with it. Confidentiality is actually, you know, a mechanism of respect. We respect somebody's right to confidentiality. What happens then when we are doing contact tracing, you know? I think the good thing that has happened around COVID is perhaps many of the things that Tom said that we are doing over the phone are not sensitive topics, but, you know, are we in some regards, you know, if there's going to be mandated reporting of cases of COVID, this and the other, are we still respecting the respondents' right to confidentiality? And do they understand the confidentiality mechanisms we have and the reportable activities that, you know, we are mandated to report under COVID? Then respect for time, culture, and beliefs. Regardless of where the pandemic has taken us, as evaluators, we still have a mandate to respect somebody's time. We don't ask more questions than we need to. We don't collect more data. We respect their culture and their beliefs, and for the respondent and the community to maintain those, even as all these public health things we are researching on are coming into play. Integrity also, you know, and now, COVID, as I've said before, presents integrity challenges. Yeah, you know, we are in a real-time data era. Yeah, so you know, there's a risk to rush through the processes, impartiality, professionalism. You know, sometimes we are getting a few people. I'm not saying for UNICEF, there's a risk of getting a few people to represent communities that they may not really represent, but the standard of integrity is still an ethical standard as evaluators that we are still obligated to follow, yeah? And then when we are talking about integrity, we also think about quality. Do we have the necessary mechanisms, yeah, to ensure that? You know, so the standards have remained. It might be true that, you know, there are limitations of traditional ways, but are we thinking about new mechanisms of actually abiding with these standards? And it's always a balance. How about equity? When we talk about justice, yeah, who is benefiting and who is sharing the burden, yeah? We know that in some of these modalities, in many of the modalities, you know, phone and the others that Tom has talked about, you know, there are populations, there are segments of our populations that may not have a phone. Are we leaving them out, you know? Or are there mechanisms that we can use to reach them, yeah? And so, you know, the other question is who is bearing the burden and who is benefiting? For example, are we making sure that, you know, children's voices are being heard? You know, we used to do in some of our evaluations in other places would do, you know, child assent, the parent consents, the child assents. Right now, in many settings, we are not able to reach the children. Does that necessarily mean that we will eliminate them, that their voices are not going to be heard? So justice and equity is still a principle, even in the pandemic, that we have to try and achieve, yeah? Accountability, we are still accountable. We are accountable to affected populations. Then accountability also puts into play the methodology, yeah? We are accountable and we need to be accountable by using the strongest methodologies that we can get under the settings we are in. COVID does not justify any, and I don't even know the word to use. You know, we can't just pull out any method there. We have to pull the strongest method that will answer the evaluation questions given the limitation. We are still accountable. Handling the added risks that COVID brings. And there are questions that we need to ask here. For example, do we have the necessary protections that protect the respondent and the risk they may face if they're doing data face-to-face collection? Do we have written somebody actually contracts COVID from an interviewer or an interviewee, where do we refer them to, you know? So the referral process, and every country is going to be different. I don't know what Bhutan has, but, you know, the referral process is something that we need to know, yeah? And then confidentiality, how are we ensuring confidentiality? What if somebody dies, if we are doing face-to-face data collection? What are the liability issues? What do the government procedures say? So all of this doesn't stand in a vacuum, yeah? It is in line with the government says, but as by these ethical standards, yeah? And then of course, how do we ensure equity, yeah? How do we ensure equity to the evaluation process? Meaning that, you know, everybody who should be involved, from, you know, regardless of where we are, we try. Of course, there are going to be limitations. And as another aspect of accountability, saying it as it is, articulating the limitations that we come across in the time of COVID. So I will stop there and then open up to discussion. So this is just food for thought, all of this, to get our minds thinking. And I know, you know, for those of you who are doing evaluations, you faced all of this. But, you know, thinking about it and how do we brainstorm more and more to make sure that we are still in line with the ethical principles, while at the same time solving problems and giving people the best quality data we can in this era of COVID. So thanks a lot, and over to you, Rose, and the other facilitators.
Thank you so much, Dr. Esther, for the informative and interesting session. So if you have any question from the participants, please raise your hand, or you can write it in the chat box. Just a reminder that we'll be only taking one question for this session, since we're running out of the time. I think there are no questions.
Okay, so thank you very much. Over to you.
Okay, thank you so much once again. We have now come to the end of our session. I would like to thank all the speakers for sharing their knowledge with us. The session was very informative, well prepared, and interesting. I hope everybody felt the same. I hope we continue to have such sessions in future to enrich our knowledge in the field of evaluation. Now, I would like to invite Ms. Karma Chorin, who's the board member of EAB, to give us a vote of thanks and share EAB's way forward. Over to you, Ma'am Karma.
Thank you so much. Can you all hear me? My internet is very unstable, so I've kept quiet till now.
But your voice is very clear, to cut to at least.
I'm so glad. I'm so glad. Anyway, to people who don't know me, I'm Karma Chorin, and I'd like to first take this opportunity to commend our excellent trainers, Rose, Dr. Esther, and Tom from Rosa, on taking your time to be with us and sharing your experience and insight with the members of the EAB. We are, I think, indeed fortunate to have this well-timed training during unprecedented times of COVID-19. It's also very opportune that we at EAB need to understand the functions of evaluation in development work, especially on how to make evaluation more responsive by incorporating new technologies and approaches. I suppose going virtual is definitely one of them, but how can we adapt these effective tools to sustain beyond the pandemic is a thought worth considering for all of us, I think. Most of us who are practicing evaluation and involved in data collection during COVID times have encountered the challenges and risks and the ethical concerns posed by face-to-face interactions, and we have considered several innovations to ensure maximum ethical adherence to your work. So I deeply resonate with your presentation, Esther, and I've actually had to really think hard on how we can create better ways and ensure that the burden is always less than the benefits. And thank you so much for that presentation. I think this would be these are needling issues that are eye-opening for every member of the EAB. Thank you so much. I would also like to take this opportunity to thank the Deputy Resident Rep, Marie Consoli, for her thoughtful words and UNICEF's unequivocal support towards EAB. UNICEF's support has resulted in a validation for EAB to create a culturally responsive evaluation in the country, to say the least. Towards this aim, we have continuously explored exchanges of ideas on various regional and international platforms, as reiterated by my colleagues, mentioned by my colleagues before. We've encouraged our members to be part of larger evaluation networks, as well as initiated research activities. Our one ongoing situation analysis survey is crucial to understand the evaluation needs in the country in order for EAB to strategize and plan activities that suit these needs, mostly in times of COVID-19. As a way forward, we intend to continuously explore opportunities of interaction with senior government officials, corporations, and private sector, as well as with parliamentarians and community leaders in order to promote the work EAB is engaged in, and also to advocate the need for evaluation as part of learning and good governance initiatives. We also hope to make strides in networking among our international development partners in the country after our situation analysis is complete. Therefore, I think Dichen is present and a lot of our UNICEF friends are here. So I would like to take this opportunity to seek UNICEF's continued support towards EAB's activities. Today, we would like to seek UNICEF support towards our networking efforts with other international development partners in the country and outside. I think your support would raise EAB's profile and we stand a better chance at advocating successfully with the help of UNICEF. Currently, we have been missing out on that platform, and any help towards this would be deeply beneficial for EAB. Having said that, please do know that we are deeply grateful for UNICEF's unconditional support towards our mandate till now, and we only hope to extend our gratitude by achieving our goals. Finally, I would be remiss not to extend our deepest gratitude to Ms. Dichen Zam at UNICEF for her unwavering faith in EAB and the continued support she has always extended to us. Thank you so much, Dichen. And thank you also to all our participants for being willing learners. Thank you all, and I hope you all have a great weekend ahead.
If I may, before we conclude, if I may just pick on one of the points that Marie Consley has mentioned earlier, because I'm taking advantage of this platform, this meeting, because I know it's difficult to again come together, all of us. So Marie Consley has been, she has raised and she thought about, how about, how do we institutionalize the capacity building on evaluation functions in the country. So I see an opportunity there, how EAB and the government and the UNICEF can come together and ensure that there is a continuous learning in evaluation in a very systematic way. Yes. I would like to invite Dr. Finz to share Dr. Finz's point on this also.
I think you've, may I? No, Dr. Finzo, why don't you go ahead?
Please go ahead, Karma, if you have anything to add to this.
No, I think what Dichen has raised and raised the point is very valid, and we actually hoped to, we've had this discussion several times among our board directors. We've been talking about how we can institutionalize evaluation practices and methods in the country, right? And then also to set up our own network among government and other international development partners. So rightfully so, but we do hope to work on it harder after our situation analysis, because a lot of the information that we would require to strategize on how to move forward and find our way forward would be through the analysis of the situation analysis survey that we're doing.
Yeah, that's exactly like I would echo what Karma has mentioned just now. We have like within our board of trustees, we have all the time discussing about how to strengthen our capacity building and institution of capacity building activities within the country, and we hope to do a lot of that through after we analyze when we have our situation analysis report ready. So we are depending on that so much because we have a lot of, we hope to get a lot of information from there, how to strategize our way forward, and then collaborating with all the key government players as well as the parliamentarians, and all things will be like once we have that situation analysis report, then we will be able to develop our strategy and the way forward for the evaluation association. And then after that, we would be able to approach or collaborate with a number of government key players as well as UNICEF and all other stakeholders to come into collaboration to institutionalize the capacity building, as well as we are thinking of our main mission is to build a strong evaluation culture in the country. So we would also like to follow up with the national evaluation policy that to be enacted or implemented, so that would give us the proper guide to how to position ourselves, and also like we would be able to take out our own strategies and way forward for the EAB once our situation analysis is done and ready. So we are backing on that so much at the moment. But as Karma has said, this is quite relevant to us, and we have always been talking within our Board of Trustees and the core working group of EAB.
Plus,
Plus.
I think the Rosa team needs to leave, right? So because they're the ones hosting us, so we'll probably have to say goodbye, though we want to continue on the conversation. Is it okay? We all say goodbye?
Yeah, I don't think that if I end on my side, I don't think your call, the Zoom will end though. So you can continue. It's just that we have a regional level meeting that we need to be present in. And I also wanted to say that definitely we'll discuss, and we have good examples at the regional level from other countries where they've done exactly the capacity building the way you're now envisioning it, which is a four-way. For instance, UNICEF Country Office, the Evaluation Association, together with the government, and even then the fourth way, the university. So we'll be happy to engage in that discussion. But we really need to drop out now. So thank you, and have a nice weekend, everyone.
Thank you, Rose. Thank you, Tom. Thank you, Esther.
Thank you. Bye-bye.
Bye. Thank you so much.
Will I be? Can I assign the hosting to Dechen, or who shall I assign the meeting? Tashi? Tashi. Okay. So Tashi, I'm assigning and leaving.
Before we end this session, I would like to request if all our participants can show their face so that I can take a screenshot for these sessions for the EAB records. I think all we have left. I would like to request if other participants can show your face.
And why don't you turn on?
Everyone, please, if you can turn on your video, we want to have a screenshot of this so that we can record our first ever virtual training. Yeah.
Okay. So go ahead. We're all ready.
Okay, thank you, everyone. And the last one is this Dechen? Vivo 1819.
Right. Yeah, so maybe another, yeah. So we have Tashi, Tek, and Dechen, and also maybe another one here.
Done. Thank you, everyone.
Yes,
Okay,
thank you so much. Thank you so much for the participants.
So are we continuing on that, Nina?
Yes,
are we continuing? Where's Dechen? Dechen, are you online? Still online?
No, I think she's gone. So I think it's just going to be the four of us that's going to continue. So we'd like to probably maybe thank the other participants for coming.
Yeah, yeah. Because I think this is something like we need another session to discuss. Yeah. So not something where we will afterthoughts they discuss many members. So we need a serious discussion on that, where we want to also engage our members along with our we are seriously thinking about developing our strategy, and as well as the way forward for the EAB, and also like institutionalizing the capacity building activities and all those. So this requires really another next session or a separate session, not as a part of this training activity, I think. Yeah. So thank you everyone for participation, and Dechen and Tashi has been doing very well today, and we will look forward to having more of these virtual events in future. So now you are trained and you can host number of events, right? Yeah.
So I think it's just, okay, I think we'll say goodbye to Sonam, Tashi, and Tekla. Thank you so much, Tek. Bye-bye. Bye, Tashi. Bye, Sonam Gelson.